World Suicide Prevention Day, it was marked at the start of the week. It's a crucially important issue for Africa, as the continent sadly has the highest average suicide rate globally. 6 of the 10 countries in the world with the highest rates are on the continent, with Lesotho right there at the top. There is a push for more infrastructure, openness, awareness, and tools to prevent suicidal deaths in Africa. I'm joined now for a closer look at the issues by Professor Taiwo Lateef Sheikh, the Africa coordinator for the Lifeline charity. Professor, thanks so much for speaking to me. First of all, so as I mentioned there, Lesotho is right at the top of the global list for the highest suicide rates, and the rate across the continent is also higher than anywhere else. Why is that the case? What can you tell us about this?
Thank you very much. You've said what is very correct. The suicide rates across Africa is the highest among all the other continents in the world. However, it is very important that we understand that the factors involved are so many, but I'll mention quite a number because of time. What is common among the low-income countries where suicide is very high is the commonality of the what we call social determinants of suicide. You find this across all the low-income countries, but it's highest in African continent. And this social determinants includes things like poverty, especially lack of purchasing power, unemployment, civil strife and terrorism, human rights abuses, and so on. These are social determinants that you find very high on the African continent. We also know that over 90% of cases of suicide are related to mental health conditions. And in Africa, access to quality and effective mental health intervention is very, very limited because of very obvious reasons: lack of availability of mental health services and barriers to uptake of such mental health services in Africa is also very poor. So where you have mental health conditions as an indicator for suicide, and you have lack of availability of access, barriers to uptake, you will also likely to have very high level of suicide in Africa. And then I also need to mention that Africa is a youthful continent, and suicide among the youths, especially between the ages of 15 and 29, is highest in Africa compared to other continents in the world. And because Africa is a youthful continent, and you have very high suicide rate among youths, then it's likely going to be very high on the African continent. So there are other issues that are related to this high number of percentage of suicide on the continent, which also include the issue of criminalization of suicide. Where suicide is criminalized, people don't come forward to uptake services available. People don't discuss it openly, and this can also lead to increased number of suicide on the continent.
Now, when it comes to the issue of criminalization of suicide, you were mentioning to me earlier that you're particularly concerned about how that poses an impediment to the continent's ability to bring down those suicide rates. And you were saying that it also gets in the way of a more compassionate approach that you believe is more culturally consistent with the region. Can you tell us a bit more about that, please?
Yes, criminalization of suicide is foreign to Africa. It's a legacy left behind by the colonial governments, especially English-speaking African countries. They all have this criminalization of suicide in their Criminal Code Act. And culturally, in Africa, Africans abhor suicide. Religions in Africa abhor suicide. Traditions in Africa abhor suicides. But when it comes to people who try to take their lives by suicide, African culture is more compassionate. They support them. They try to help them to survive and not to allow them to, die by suicide. So it is a strange law that is very, very non-compassionate, that is very cruel among Africans. The colonial rulers who left us with this law have gone ahead to change their own laws and decriminalize suicide in their country. It is very important that we also align with the culture of Africa, compassionate way the Africans treat people who try to harm themselves, and expunge these laws from our Criminal Code Act.
So what other kind of support systems and tools do you want to see be made more available across Africa in order to tackle the high rates of suicide the continent's seen?
We need to have a coherent kind of governance system for suicide prevention strategies in Africa. So countries are encouraged to adapt the Africa CDC strategic plan for mental health for Africa, which was launched in 2022. This plan is signed by heads of government of Africa to be able to have a good direction and coherent strategic plan framework for suicide prevention across the country. It is also very important that we adapt crisis lines, crisis helplines that are toll-free, that people can increase access to people to get intervention for suicide prevention. These crisis helplines do not only provide intervention, but they also provide avenue to generate data for development of health system towards prevention of suicide on the continent. If we have crisis helpline, you can call it from your room, you can call the line from the market, you can call the line from anywhere, and that will further help us to generate data for health planning, planning for infrastructures for intervention, planning for budgets, planning for capacity building. These are the things that we require to be able to abate this high rate of suicide on the continent.